This is Jen and Ikina on Eyesurgeontalks. So today I wanted to discuss a news story that broke in October across all the main media sites. So it was on the BBC, it was on the Guardian, it was on the New York Times, it was everywhere. Why did the story break? Well, it's based on a scientific paper which was published in the New England Journal of Medicine at the end of October. And this paper looked at the restoration of vision using a special implant inside the eye, which helped to restore some vision to patients with advanced macular degeneration. So, as eye doctors, of course, it was very, very exciting to hear, and even more exciting to hear for our patients out there who are suffering with this. I've worked with one of the co-authors in the past, Mr. Mahi Mukit, who did some of the surgery at Moorfields. And so I did know a bit of a background beforehand, and also some of the previous trials on similar implants. So I wanted to talk a bit about it and to explain what the study was and what we can hope for in the future. So first of all, what did they do? So the trial looked at, I think, 38 patients that had lost central vision due to dry macular degeneration. So this is a condition where you lose the retinal cells that do the seeing, the little photoreceptors in the retina, but the rest of the retina stays healthy, so you still retain all the kind of cabling and the nerve connections. And so the patients preserve their peripheral vision, but the very center is very blurred, and so they stop being able to read and recognize faces and struggle to see the letter chart of the opticians in the end stages of the disease. And during the trial, they took a microchip and implanted it surgically underneath the retina inside the eye. And then the patient would wear special glasses that pick up the light like a camera and project the image of the outside world into the eye onto this microchip. And the chip then uses the sort of nerve connections inside the eye in the retina to send the images to the brain. Now, very exciting. This is very kind of high technology, futuristic sounding solutions. And of course, there was a lot of sort of interest from patients. We had a lot of queries immediately about it. How successful was the treatment? Well, some of the patients in the trial got very, very good visual improvements. They were able to read text, obviously with reading glasses after surgery, and almost everybody, not quite everybody, almost everybody got some improvement in vision. And on average, this was probably about 2 lines on the vision chart, the one you'd use at the optician. So the study defined this as meaningful visual improvement, which I think is a nice real-world term. It's not kind of using sort of arbitrary visual criteria, but it's saying, well, did this vision make a difference? So amazing technology. What can we hope to use it in the near future? Well, we hate to be the harbingers of bad news as doctors, but unfortunately, the answer to that is going to be a no. And why is that? Well, number of reasons. First of all, we're limited simply with time and surgical technique because it's quite a lengthy and complex surgery. And I think the numbers of patients we have with this condition and the number of retinal surgeons we have, we will very quickly run out of time and people to be able to do this for all patients. Secondly, they did have quite a number of complications from the surgery in the study. Most of them they were able to sort out with time, with some extra treatment. But ultimately, it's not it's not a very straightforward course. You need to look after these patients very closely, and again, this will take a lot of time and a lot of care. And so, at the moment, the technology we can't see it getting scalable to large numbers of patients. And of course, in the real world, the patient selection is a much very relevant sort of factor versus patient selection in the studies. So you need to have a particular type of visual loss, no other eye problems. You need to be fit and well, and you need to be able to be followed up closely. Notwithstanding all these factors, are we excited? Very much so. Should patients be excited? Yes, but I think realistically, we're looking at more research in this area, more development of the technology, and hopefully in the future it will become more scalable and we could offer it to a great variety of patients and help all our patients see better, which of course is what we want to do as eye surgeons. I have put a few links down in the description of the video about other research projects and trials you can get involved with in the Moorfields research team, and also the team's presentation on the trial, another YouTube link, so please feel free to explore those. And we look forward to more developments in technology for restoring sight.